The hardest question I get from families is the one nobody wants to ask. How long has this been going on? The truthful answer, in nearly every case I see, is years, not weeks, not months. Years. The signs were there. They were just mistaken for something else. By the time families realize something is genuinely wrong, the disease has often been progressing silently for 5 to 10 years. And the part nobody tells them clearly enough is that the brain shows specific warnings months or even years before the formal diagnosis happens. You just have to know what they look like. There really is a version of this where you start forgetting names a little more often. You walk into a room and forget why. You repeat a story to your spouse without realizing it. You misplace the same set of keys for the third time this week. You feel a little foggier than you used to, especially in the late afternoon. Most people just blame it on age. And yes, certain things do happen with time. But in my opinion, almost all of these get blamed on aging when something else may be quietly developing underneath. And the reason I care about this so much is that I see it constantly in the families I work with. Adult children sitting across from me asking the question that nobody wants to ask. How long has this been going on? When did it start? But I also see the opposite. Adults in their 70s and 80s who are sharp, engaged, present, fully themselves, whose families are not waiting for the next confused phone call, who continue living independently and confidently for decades. The difference between those two groups is rarely genetics. It is whether someone noticed the early signs and acted on them while the window for intervention was still open. So, what we are going to talk about today are 10 specific early signs of dementia that most people miss or dismiss. I am going to walk you through them in order, with the most subtle ones first and the most serious ones last. And at the end, I will tell you exactly what to do if you recognize any of them in yourself or in someone you love. From around the age of 60, your brain undergoes changes that most people are never warned about. Some of those changes are normal, some are not. The trouble is that the early signs of dementia look almost exactly like normal aging, which is why so many cases get caught late. By the time families realize something is genuinely wrong, the disease has often been progressing silently for 5 to 10 years. That sounds frightening. It does not have to be. The reason early detection matters is that the treatments and lifestyle interventions we have today can meaningfully slow progression in many cases, and the earlier they start, the better they work. The clinical term for what we are talking about is dementia, which is an umbrella covering several conditions including Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. Alzheimer's is by far the most common, accounting for roughly 60 to 70% of cases. A study following over 50,000 adults found that those whose early dementia symptoms were identified and addressed within the first 2 years of onset had significantly better functional outcomes 5 years later than those whose symptoms went unrecognized for 4 or more years. And another major review found that lifestyle interventions started in the early stages of cognitive decline could delay progression by up to 5 years in many patients. So this is not fixed. It is not inevitable. And the time to start paying attention is well before someone in your family asks the question that nobody wants to ask. Here is something most people never think about. Your brain is the most metabolically demanding organ in your body. It uses about 20% of your daily energy, despite being only 2% of your body weight, which means it is also the most sensitive organ to small declines in blood flow, blood sugar regulation, sleep quality, and inflammation. The same systems that drive heart disease and fatty liver also drive dementia. The brain just shows the damage in a different way. When we walk through the 10 signs, what you are actually seeing is the brain telling you that the conditions it depends on are starting to slip. Catching those signals while they are still small gives you a chance to support the brain in ways that genuinely matter. Number 10 on the list, and the one most people dismiss as normal aging, is short-term memory loss that interferes with daily life. Here is the difference that matters. Forgetting where you put your keys is normal. Forgetting that you put them somewhere at all is not. Forgetting a name and remembering it later is normal. Forgetting that you had a conversation with your daughter yesterday is not. The pattern with early dementia is not occasional forgetfulness, it is repetition. Asking the same question 2 or 3 times within an hour. Forgetting recent meals or appointments, even when written down. Telling the same story to the same person within the same conversation, without realizing it. Long-term memories often stay clear, which is why families get confused. The person can describe their wedding day in detail, but cannot remember what they had for lunch. If you see this pattern in yourself or someone you love, write it down. Note specific examples. The pattern over weeks is what matters, not any single moment. There is also something worth knowing about how this often appears differently in different people. Some adults compensate for early memory problems by becoming very organized, sticky notes everywhere, multiple alarms on the phone, detailed calendars, lists for everything. The compensations themselves are not a problem. Many of us use them. The signal is when those compensations start failing too. The sticky notes get forgotten. The alarms ring, and the person does not remember why. The detailed calendar is no longer enough. Other adults try to hide the issue from family for as long as possible. They may avoid conversations where they would be expected to remember details. They may pivot away from topics that require memory. They may laugh things off or change the subject. If you have noticed someone you love doing this more often than they used to, that is worth paying attention to. Number 9 on the list is difficulty with familiar tasks. This one is genuinely useful to spot because it tells you the brain is struggling with sequenced thinking, not just memory. Watch for someone who has cooked the same recipe for 30 years suddenly forgetting steps. Watch for someone who has used a microwave for decades, suddenly looking at the buttons with confusion. Watch for someone who has driven to the grocery store every week for 20 years, suddenly getting lost on the way. These are not memory problems exactly. They are breakdowns in something called executive function, which is the brain's ability to plan, organize, and sequence steps. When executive function starts to slip, familiar tasks suddenly require concentration. Things that used to be automatic now require effort. A useful test you can do at home. Ask the person to make a simple recipe they have made many times. Watch how they handle the sequence. Do they pause longer than they used to? Do they skip steps? Do they need to look up things they would have known automatically? The pattern tells you more than any single moment. A few years ago, the daughter of one of my patients told me about the moment she realized something was wrong with her mother. Her mother had made the same Thanksgiving turkey for 40 years. That year, the daughter walked into the kitchen and found her mother standing in front of the open oven with the raw turkey on the counter, holding the pan, looking confused about what came next. She had stopped midway through a recipe she could have done in her sleep just 2 years earlier. That moment was the start of the family finally understanding what was happening. It was also, in retrospect, far from the first sign. The earlier signs had been there for over a year. Nobody had noticed them as anything serious until that moment in the kitchen. If you have a moment like that with someone you love, do not wait for the next one. That moment is worth a doctor visit. Number 8 on the list is word-finding problems. Most people know about this one, but most people get it wrong. Pausing to find a word is not the issue. Everyone does that. The issue is the pattern. Watch for someone substituting general words for specific ones, saying, the thing you write with instead of pen, saying, that lady from across the street, instead of remembering her name even after being reminded multiple times, saying, do the thing with the food instead of warm up dinner. Watch for someone losing the thread of a conversation. They start telling a story and seem unable to find the words to continue it. Or they ask a question that was just answered 5 minutes ago. Or they get confused when more than 2 people are talking. Reading often becomes harder at the same time. Someone who used to enjoy a daily newspaper might start reading the same paragraph multiple times without absorbing it. Someone who finished a book a week might suddenly stop reading entirely. These changes are subtle. They build slowly. But once you know to look for them, they become much easier to recognize. Number 7 on the list is disorientation in time and place. This is the sign that almost always shows up before families realize what is happening, and it is one of the most reliable early warning signs we have. Watch for confusion about days of the week or months. Not occasional, is today Wednesday or Thursday, but frequent and persistent. Someone might think it is morning when it is evening. Believe a season is happening, that is not. Lose track of how much time has passed during a normal activity. Watch for getting lost in familiar places. The first time it happens is usually in a new environment, a grocery store, a medical office, but over time, it can happen at home. Forgetting which door leads to the bathroom, walking into the wrong room, becoming confused on a street they have lived on for 20 years. Time and place are processed in specific brain regions that dementia affects early, which is why this sign tends to show up before families notice memory problems. When you spot disorientation, you are seeing the brain telling you that those regions are under stress. If you have noticed this in yourself or someone close to you, this is worth taking to a doctor. Not as panic, as information. A practical way to track this safely is to ask a few simple orientation questions over a period of weeks. What day is today? What month? What season? What year? Where are we right now? These are the same questions doctors use in cognitive screening. If the person can answer them clearly and consistently, the orientation centers in their brain are working well. If they hesitate or get confused on more than one of these regularly, that is meaningful information to bring to a medical visit. For people who have already shown signs of disorientation, simple home modifications can help. A large, clearly visible clock with the day and date on it. Labels on doors showing what is behind them. A whiteboard in a common area with the day's plans written down. These adjustments do not slow the disease, but they do reduce the daily anxiety the person feels when they cannot orient themselves, which improves quality of life for everyone in the household. Number 6 on the list is changes in judgment and decision-making. This one is genuinely concerning when it shows up because it tends to mean the disease has been progressing for some time. Watch for unusually large purchases that the person cannot afford or does not need. Watch for falling for scams that they would have recognized easily before. Watch for giving money away to people or causes that do not make sense. Some patients become extremely generous to a degree that does not match their values. Others become suspicious of legitimate institutions and refuse to pay legitimate bills. Watch for hygiene changes. Someone who always cared about how they looked may stop bathing regularly, wear the same clothes for days, forget to brush their teeth. This is not depression in most cases. It is the brain losing the ability to track and prioritize self-care. Watch for medical decisions that do not match their previous values. Refusing medications they have taken for years, skipping doctor appointments without rescheduling, ignoring obvious symptoms. These changes happen because the brain regions responsible for judgment are being affected by the disease process. The person is not making bad choices on purpose. The biology that supports good judgment is being eroded. Number 5 on the list is misplacing things in unusual locations. Misplacing items is normal. Everyone does it. The pattern with dementia is different. Watch for items found in places that make no logical sense. Milk in the pantry instead of the refrigerator. Car keys in the freezer. Important documents tucked into a coat pocket and forgotten. The wallet in the bread drawer. Glasses on top of the dryer. Watch for the inability to retrace steps. Most people, when they cannot find something, can mentally walk back through what they did to figure out where it might be. Someone with early dementia loses that ability. They look in the same place 5 times. They cannot reconstruct where they were. Watch for accusations of theft. This is one of the most painful signs for families. The person, unable to find something, becomes convinced someone has taken it. They may accuse a spouse, a child, a neighbor, or a caregiver. The accusations come from frustration and fear, not malice. When you see this pattern, the kindest response is not to argue. It is to gently help look. The accusations are not really about the missing item. They are about a brain that no longer trusts its own memory. Number 4 on the list is mood and personality changes. This sign often shows up before memory problems become obvious, which is why it is so commonly missed. Now let me set a comment goal here. After this section, drop a comment below telling me which of the signs you have noticed in yourself or in someone you love. The patterns help me understand what topics to make next, and they help other people watching feel less alone. Now back to mood and personality. Watch for depression and anxiety that emerge without an obvious cause. Persistent sadness, worry that feels disconnected from circumstances, a sense of hopelessness that did not exist before. These changes can show up months or years before the memory problems begin. Watch for irritability in someone who used to be patient, apathy in someone who used to be engaged, withdrawal from hobbies and interests they have loved for decades, a bookworm who stops reading, a gardener who stops gardening, a grandmother who stops calling her grandchildren. Watch for paranoia and suspicion, believing a spouse is being unfaithful, believing neighbors are watching, believing food has been tampered with. These delusions feel completely real to the person experiencing them, which is why arguing with them does not work. Watch for personality shifts. The outgoing person who becomes withdrawn, the reserved person who suddenly says inappropriate things in public, the patient parent who becomes easily angered. If you see these changes paired with any of the earlier memory or task signs, that is the moment to schedule a doctor visit. Not next month, this month. Number 3 on the list is withdrawal from social activities. This is one of the most reliable early warning signs we have, and it is one of the easiest for families to dismiss as normal aging or temporary mood. Watch for someone declining invitations they would have accepted before, skipping the weekly church service they have attended for 30 years, dropping out of the bridge group, stopping the Sunday family dinners, saying they are too tired when in fact they are afraid. The hidden reason behind much of this withdrawal is that the person has noticed their own cognitive changes before the family has, and they are trying to hide it. Avoiding conversations means avoiding the moments when they cannot find words. Avoiding gatherings means avoiding the moments when they cannot follow the conversation. Avoiding new places means avoiding the moments when they get lost. Watch for someone becoming progressively quieter in group settings. Someone who used to dominate the conversation, now sitting silently. Someone who used to make jokes, now smiling and nodding without fully participating. Watch for spouses noticing that their partner has started letting them speak first in social settings, always, every time. This is sometimes the first sign a spouse picks up on, before any memory issues become obvious. The cruel irony is that social withdrawal accelerates cognitive decline. The brain stays sharper when it is engaged with other people. Pulling away from social connection speeds up exactly the process the person is trying to hide. Number 2 on the list is changes in sleep patterns. Sleep is one of the most under-recognized factors in dementia, and changes in sleep often appear early in the disease process. Watch for difficulty falling asleep that did not exist before. Watch for waking up multiple times during the night. Watch for daytime sleepiness that does not improve with rest. Watch for what doctors call sundowning, which is increased confusion, agitation, and restlessness in the late afternoon and early evening. Someone who is fairly clear in the morning becomes confused, anxious, or upset as the day progresses. This pattern is one of the most distinctive features of early dementia. Watch for reversed sleep cycles. Someone sleeping during the day and staying up at night, wandering at 3 in the morning, becoming agitated when the household is asleep. Watch for vivid, disturbing dreams, acting out dreams during sleep, kicking, talking, sometimes even getting out of bed. This particular pattern is associated with a specific type of dementia called Lewy body disease and is worth bringing to a doctor's attention. What is interesting about sleep is that the relationship goes both ways. Poor sleep accelerates cognitive decline, and cognitive decline disrupts sleep, which means addressing sleep, even when memory problems are obvious, can produce real improvements. A sleep study and proper treatment of sleep apnea, where it exists, can sometimes meaningfully slow cognitive decline. Number 1 on the list is the sign that most directly indicates the brain is being affected at a structural level: visual and spatial problems. This goes beyond the kind of vision changes that come from your eyes alone. The brain has to interpret what your eyes see, and when that interpretation breaks down, specific patterns emerge. Watch for difficulty judging distances. The person reaches for a cup and misses it. They struggle to estimate how far away a step is. They have trouble with stairs, particularly going down. They become hesitant near curbs. Watch for difficulty reading even when their glasses prescription is correct. They lose their place. They skip words. They read the same paragraph repeatedly. They cannot follow the layout of a newspaper. Watch for trouble distinguishing colors, particularly the difference between similar colors like navy and black, or red and orange. They might wear mismatched clothing without realizing. They might have trouble identifying things on their plate. Watch for confusion with mirrors. A person with advancing dementia may not recognize themselves in a mirror. They may believe a stranger is in the room. They may even speak to their own reflection. Watch for trouble with depth perception, reaching for door handles and missing, pouring water and overflowing the cup, bumping into furniture they should be able to see clearly. These visual spatial problems are among the most concerning signs because they directly increase the risk of falls, accidents, and injury. When you see them, the response is not to wait. It is to schedule a medical evaluation soon. There is also something worth knowing about how visual spatial problems affect driving specifically. Driving is one of the last activities most adults are willing to give up because it represents independence in a way few other things do. But research has been clear for years that adults with even mild visual spatial problems have measurably higher accident rates, and the people most at risk often do not realize they are at risk. If you or someone you love has shown any of the visual spatial signs we just walked through, asking the doctor for a formal driving evaluation is worth doing. Many memory clinics offer this. Some occupational therapists specialize in it. The evaluation either confirms it is safe to keep driving for now, in which case everyone has peace of mind, or it identifies a real problem that needs to be addressed before something serious happens. This is one of the hardest conversations families have. It is also one of the most important. The conversation is much easier if it starts before an accident, not after. And here is the thing nobody is going to tell you at your annual checkup. If you recognize even one or two of these signs in yourself or in someone you love, the next step is the most important step. Most adults wait too long. They notice the signs. They worry quietly. They tell themselves it is just aging. They watch for months, sometimes years. By the time they finally bring it up at a doctor visit, the disease has been progressing without intervention for far longer than it needed to. Here is what to do instead. Schedule a dedicated visit with the doctor specifically to discuss cognitive changes, not as part of a routine annual visit, a separate visit. Bring a written list of the specific changes you have noticed, with rough dates. Bring someone who knows the person well to help describe what they have seen. Ask for a baseline cognitive screening test. Tests like the MACA or the mini-cog take only a few minutes in the office and provide a clear baseline measurement. Future tests can be compared to this one to track any progression. Ask for the standard workup that rules out reversible causes of cognitive decline. Thyroid blood test, B12 level, vitamin D level, medication review. Sleep apnea screening if indicated. A small but real percentage of cases that look like dementia are actually caused by these treatable conditions. If the screening suggests genuine cognitive decline, ask for a referral to a memory clinic or a neurologist who specializes in cognitive disorders. They can run more detailed testing and confirm or rule out specific types of dementia. Our doctors would be screening for cognitive changes at every annual visit after a certain age, but that is another story. As we get to the end of this video, let me leave you with what I actually want you to do with all of this. If you are watching this and wondering whether you should be worried, here is what I want you to know. Worry without action does not help anyone. Worry with a plan does. Start with paying attention. For the next 30 days, just notice. Write down anything that strikes you as unusual in yourself or in someone you love. Repeated questions, forgotten appointments, misplaced items in strange locations, confusion about time, mood changes, withdrawal from things they used to love. The list does not have to be long, it just has to be specific. After 30 days of observation, look at what you wrote down. If the list is short and the changes seem minor, that is reassuring. If the list is longer than you expected, or if the changes are clear, that is your sign to schedule the doctor visit. Beyond the medical workup, the lifestyle changes that protect the brain are exactly the same ones that protect the heart and the liver. The Lancet Commission on Dementia Prevention found that addressing 14 modifiable risk factors over a lifetime could prevent or delay nearly half of all dementia cases. The big ones are not exotic: treating high blood pressure, managing blood sugar, staying socially engaged, getting regular physical activity, sleeping enough, protecting hearing, avoiding excess alcohol, treating depression when it appears, eating real food, maintaining a healthy weight. It really does come down to a few simple things. Pay attention to early changes without panicking about them. Get a proper medical evaluation when changes are persistent. Treat the underlying conditions that drive cognitive decline. Stay socially and physically engaged. Sleep enough. If you do that, you are not just protecting your memory. You are protecting your independence, your relationships, your sense of self, and the people who love you, who would otherwise carry the weight of watching you fade. A serious cognitive problem in your 70s or 80s does not start in your 70s or 80s. It starts decades earlier with changes that nobody noticed and nobody investigated. Now you know what those changes look like. Now you can act on them while there is still time. Take a moment to like this video and subscribe to the channel. And if someone you care about has been showing some of the signs we just talked about, share this with them or with the family member who would benefit most. These are the conversations that matter. I will see you in the next one.